The most common symptom of stones in the gallbladder is abdominal pain, and this pain usually occurs in the upper abdomen on the right side underneath the ribs, and it can go to the back, sometimes to the right shoulder blades. This pain can occur anytime during the day, but typically it occurs after a heavy meal or a fatty meal. Sometimes patients can have constant pain associated with fever and vomiting. Now, these are all some of the problems that stones cause when they are inside the gallbladder. Sometimes the stones in the gallbladder can slip out of the gallbladder and enter the bile duct too. And when they get into the bile duct, they can cause different kinds of problems. For example, if they get into the bile duct and if they block the bile duct, the patients can have jaundice. We call it as obstructive jaundice because basically the jaundice is because of obstruction of bile. The bile doesn't flow out freely into the gut. The other problem that might occur when the stones slip into the bile duct is what we call as pancreatitis. The bile duct, just before it enters the gut, is joined by another duct called pancreatic duct, which basically brings the pancreatic juice into the gut. If the stone gets stuck at that junction, in addition to patients developing problems with jaundice, they could also develop a condition called pancreatitis, which is basically inflammation of the pancreas because of obstruction of the pancreatic duct. It's a very painful condition. It can be quite serious, and sometimes patients can end up in intensive care unit with pancreatitis, and it can be a life-threatening condition too.